Hi, my name is Katie.
And my name is Dareya.
Today we're going to talk about grief, depression, and suicide, and how to get help if someone is suffering with any of these conditions.
Many people feel sad or down because of events that happen in their life, and that's perfectly normal.
We might feel sad because our dog died, or we got a bad grade on a test, or a close friend or family member has passed away. In case of the third one, a person goes through a specific kind of sadness, grief.
When a very close person to you dies, it's okay to feel sad, and the grief might be particularly intense because you were close to them.
But if you have been grieving for 4 months or more, aren't feeling better, feel depressed, can't do normal activities, are using drugs, alcohol, overeating, and thinking about ending your life because you can't live without them, or not being able to concentrate, sleep, eat, or socialize normally, then you need to seek professional help and support to try and cope with it so you can get better.
A strong feeling of sadness, discouragement, despair, or hopelessness that lasts for weeks, months, or even longer is called depression.
Signs that can indicate you or someone you know has depression can include negative feelings and mood, negative thinking, low energy and motivation, harder time concentrating and focusing, and even sometimes physical symptoms like upset stomach, loss of appetite, gaining or losing weight, headaches, and sleeping problems.
There's no single cause for depression. Many things can affect why a person is depressed, like inherited traits passed down from parents, living with a difficult family or social environment. Depression can also occur by being a reaction to a difficult or stressful life situation or multiple situations.
Depression occurs because a person may have an imbalance of chemicals in the brain called neurotransmitters, which affect mood. Many things can affect the chemicals like the time of day, seasons, social environment, and even medical conditions.
Teens can have different symptoms compared to adults. A teen may be in a more irritable or angry mood and can have unexplained aches and pains. Also, when depressed, teens can be extremely sensitive to criticism and can isolate themselves from some people, but not all.
If teen depression is left untreated, it could lead to problems at school like bad grades and behavioral issues. Untreated depression could also lead to an internet addiction, reckless behavior, low self-esteem, and running away. More commonly in males, there is a risk of drug or alcohol abuse and violence, and more commonly in females, an effect of untreated depression is an eating disorder.
Like the other side effects of depression, it can cloud a person's thinking. When someone's thinking is clouded, it is harder for them to reach for help. Severe depression can lead someone to think that life isn't worth living. When depression is so severe, it becomes a medical emergency.
People who are extremely depressed can think about harming themselves or suicide, and those people need help as soon as possible.
Teenagers that think about suicide are trying to get away from a situation that seems impossible to deal with or from bad thoughts or feelings.
Other reasons why they might think about ending their life is because they were rejected, hurt, lost someone they loved. They think that they're an embarrassment to others, feel unwanted, and the biggest reason is that they feel unloved or a burden to others.
Causes that lead to suicide can include depression and substance abuse. Also, when people think about suicide, they can plan it out, but most people make an impulse decision because they want to escape a bad situation.
When people think about suicide, they aren't actually sure they want to die. Many just want to express emotional pain and think that suicide is the only way to get their point across. Sadly, many people who didn't mean to kill themselves end up dead or critically ill.
If you or someone you know is planning to kill themselves, there are warning signs to watch out for, like talking about suicide or death in general, talking about going away, referring to things they won't be needing and giving away possessions, having no desire to take part in favorite things or activities, having trouble concentrating or thinking clearly, experiencing changes in eating or sleeping habits, and engaging in self-destructive behavior, including drinking alcohol, taking drugs, or cutting.
If you have been thinking about suicide, you need to get help immediately. You can't wait and hope that your mood might improve. Talk to someone you can trust, or if you don't have anyone to talk to, you can call a suicide crisis line like 1-800-SUICIDE.
Sometimes when a teen or an adult is going through a tough time, depression, or thinking about suicide, it may be easier for them to talk to a therapist than a family member or friend. Therapy can often help people when they are going through difficult times. Choosing whether or not to go to therapy can be a difficult decision for someone. They may need some guidance from family and friends.
People who have gone to therapists often find that they learned a lot about themselves and that therapy helped them grow and mature. Another resource that is available specifically for teens is school counselors. A school counselor can help with a variety of problems, from school problems to personal issues. If you are in need of talking to your counselor, set up an appointment. These appointments could be in a small group or more commonly in private meetings.
A lot of people are concerned about the cost of therapy. If a teen is able to go to a school counselor, it is completely free. But some other options that are free or low-cost mental health care include local mental health care centers and clinics, hospitals, colleges, and universities, on-campus health services, employee assistance programs, and private therapists.
All in all, if you or someone you know is suffering from depression or is thinking about suicide, please try and get help. It could save a life.